Hi, and welcome to Cabarrus County Updates. I'm your host, David Baxter, with the Cabarrus County Communication and Outreach Department. On Cabarrus County Updates, we always like to bring to you topics of interest to you right now. And probably no bigger topic is the flu illnesses that are going around and what's going on here in Cabarrus County and how we can prevent that. So to help us, we have a very special guest, Dr. Fred Pilkington, who is the CEO and Public Health Director of the Cabarrus Health Alliance. Fred, appreciate you being on here today.
Thank you for having me.
Let's just get right to it. Now, do we have a lot of flu-type illnesses around here in Cabarrus County, and are these the kind of the regular seasonal flu or that H1N1 swine flu we're hearing about?
So far this year, we really don't have the seasonal flu. What we have, almost every case of flu will be H1N1. CDC estimates about 95% of all the flu that's going around in the nation is H1N1 at this time.
Now, what's the Cabarrus Health Alliance doing about this?
Well, we just got our H1N1 flu supply in yesterday, so we'll begin it distributing. We got 1,000 doses initially. That's only a small portion of what we were to get delivered to us. Same thing's true of all other health departments in the nation. It's coming in dribbles. It'll be coming in greater quantities as it's being manufactured. The problem is it's just now starting to come in because the manufacturers have just caught up with the demand. So we've got our 1,000 doses. The first doses will go to healthcare workers in the community, both in the health department and in the community. And then we will go with some shots, or not shots, this is a nasal at this point in time. We'll go with that in our own workers in the Health Alliance. As we get more in, they'll be distributed to the physicians' offices for the patients there and for other patients in the community. Seasonal flu, on the other hand, seasonal flu shots have been out there for quite a while and have been available in every pharmacy, every grocery store just about. You've probably seen those. So the seasonal flu shots have been out there and been available. The common misconception right now is that the H1N1 flu is already out there. Why are we doing these administrations of vaccine? And the answer is that we only have about 5% of the population that has contracted H1N1 at this point. So there's still 95% of the population that needs protection.
Well, who would get the H1N1 vaccine?
Well, the priority areas have been established by the Centers for Disease Control, and number one priority is pregnant women. So pregnant women would be the first people to get it. The second would be children in the age category of 6 months to 24 years. These are based on the areas where the highest infections have occurred, as well as the most dramatic results. So those are the two priorities. Then third would be healthcare workers. Fourth will be those children, the people who have chronic illnesses, and that would be diabetes, asthma, things like that.
Okay. So that age group, so the older age group is kind of on the low end of priority. Yeah,
for example, right now, the healthcare workers who can receive the nasal is not anyone over age 50, so I can't receive the nasal at this point in time because we haven't, our experience has been with the H1N1 flu that older folks are not having as dramatic results with it. So we're not as concerned about what will happen to them if they get H1N1, which is just the opposite of the seasonal flu, where we end up with somewhere in the neighborhood of 30,000 deaths a year in the United States, almost every year, sometimes higher, from seasonal flu. So we've always been very much promoting and emphasizing the need for seasonal flu shots because we do have so many deaths. We have had much fewer deaths with H1N1, but it's been of the younger population, which is a much more concern because it's dramatically affecting younger people as opposed to the older population.
Okay. Now, will the Cabarrus Health Alliance be offering this, and where would you get the?
We will be offering it as soon as we get the vaccine. As the vaccine comes in, we get it distributed to the medical providers in the community first, and then to our own clinics themselves. Then we'll start dealing with the public and offering it through education and other promotions that it's available now at the Health Alliance. You can get it here. And again, it will be targeted toward those priority groups. We hope that a lot of what will happen is that, for example, pregnant women will get it in their OBGYN offices. We hope that children will get it in their pediatric offices. But for those folks who can't get it through their usual provider, that's where the Cabarrus Health Alliance will come in as being the provider for those administrations.
Okay. Is there a cost?
There will be no cost for it unless your private physician decides to charge an administration fee. They can't charge for the vaccine or the supplies because those are delivered to them. The only thing they can charge for would be the administering of it. At the Health Alliance, there will not be a charge.
Okay. What are the steps that a person can take to, lessen the chance of them getting the flu, whether it's seasonal or the H1N1?
That's a great question. The common misconception by most people is that the only place that you can get a cold, flu, or anything else is by touching your mouth. And we continually emphasize to folks it's mouth, nose, and eyes. And people don't often understand that just reaching up and touching your eye is, if you've already handled a doorknob or something, is just as good as your mouth. And so we encourage folks, wash your hands. And we repeatedly wash your hands. We want our public to remember that they should go out, when they're out in public, every time there's a chance to wash your hands, wash them for at least 20 seconds. The two ways to remember that is do the ABC song in your head, and that's one way, or sing happy birthday twice. That's the two ways that the CDC has recommended you've got enough length of time with hand wash. Hand wash is not available. Backup is always the sanitation cleansers that you can rub on your hands that are usually alcohol based. That's not as good as hand washing. It never is, but hand washing is your best priority. Most importantly, cover your mouth and your nose if you sneeze or cough. And we recommend very strongly that people use their elbow as much as possible to cover their sneezes and their coughs, or anything else, a cloth, anything you can. I was recently at a conference that the Institute of Medicine had on H1N1, and one of the CDC experts was talking about the spread, and he said, what people fail to understand is that if I'm sitting here next to you and I sneeze, it's instantly in your mucous membranes. Sneeze travels at 155,000 miles per hour, so it's out of me into you and touching your mucous membranes if I don't cover in milliseconds. So you've got my germs that quickly. And as he went on to say, I hate to say it this crudely, he said, but a good person can do it from 20 feet and contaminate everybody. A really good one from 60 feet.
Whoa!
So it's really important that people cover their nose, their mouth, and do a good job of protecting other folks.
Okay, that's pretty amazing. Where can the Cabarrus County citizens get more information about all of this?
They can get it from our website, and they can go online and look at www.cabarrushealth.org. And CDC's website is cdc.gov. There's a link to it on our website. You can go to the Cabarrus County website. That's linked to our website. So there's lots of different ways to get information that's really credible and quick information from those websites. You can also talk to your private provider if you're there. Talk to anyone at the Public Health Department. Give us a call. We'll talk to you about it. Look at the information that's being made available through a variety of public sources about H1N1. There's something constantly on the television and the news about it, and most of those stories are fairly accurate. So pay attention to what's on the news. Most importantly, with H1N1, and I keep emphasizing this, is it's very new. It started in April of this year. So we are still developing knowledge about it. So each day something new happens. If you remember, initially everybody had to have 2 administrations of the vaccine. Now some people have to have 1, some people have to have 2, depending on their age. So it's the information is changing constantly, but the ways to protect yourself never changes with flu, with a cold, or anything else.
Okay. So if, again, for more information, you can go to the www.cabarrushealth.org, or also there's a phone number. This is like a hotline, which is 704-920-1213 for more information. So, Fred, I appreciate your information, and we'll kind of keep our audience updated on what's going on and the different changes, and thanks for all you and the Health Alliance are doing.
Thank you.
Protect us. All right, until next time, you have a good day.